modifiable, treatable, non-modifiable. Age, risk rises markedly after about 55 to 60 years. Family history, genetics. Modifiable, most important, high blood pressure, hypertension. The single most important modifiable risk factor for stroke. Controlling BP considerably lowers stroke risk. www.heart.org. Atherosclerosis, high cholesterol, diabetes mellitus, atrial fibrillation, AF, a major source of cardiac emboli causing ischemic stroke. www.heart.org. Smoking, excessive alcohol, obesity, poor diet, physical inactivity. Prior TIA, transient ischemic attack. Older adults often have multiple comorbidities, e.g., hypertension plus AF plus diabetes, which compound stroke risk. 2. Symptoms. What to watch for. Fast, be fast. Recognize early signs and act fast. B. Balance, sudden loss of balance, severe dizziness, incoordination. E. Eyes, sudden blurred or double vision, or loss of vision. F. Face, facial droop on one side. Arms, weakness or numbness in one arm or leg. S. Speech, slurred or confused speech. T. Time, note time of symptom onset, critical for treatment decisions. CDC, www.stroke.org. Other signs, sudden confusion, trouble swallowing, sudden severe headache, common and hemorrhagic stroke, decreased consciousness. 3. Impact of stroke, short and long-term, physical disability, hemiparesis, mobility loss. Speech, swallowing impairment, aphasia, dysphagia, risk of aspiration. Cognitive decline, memory and executive dysfunction, emotional, behavioral changes, depression, anxiety, mood swings. Medical complications, aspiration pneumonia, DVT, pressure sores, seizures. Social, economic burden, loss of independence, caregiver strain, costs of long-term care. Early treatment and good rehabilitation increase the chance of regaining function. 4. How to respond, emergency steps and medical management. Emergency steps, bystanders, family, call emergency services immediately and state suspected stroke. Report time of onset or last known well time. Time is brain. CDC. Do not give medications, including aspirin or blood thinners, unless told by medical professionals. Treatment depends on stroke type. Do not self-transport if severe. EMS can pre-notify hospitals and start pre-hospital protocols. Hospital assessment. Immediate non-contrast CT or MRI to determine ischemic versus hemorrhagic stroke. Vascular and cardiac imaging, CTA, carotid Doppler, ECG, echo. Blood tests, glucose, coagulation. Acute treatments. Ischemic stroke, IV thrombolysis, alteplase, tenecteplase, is time-sensitive, traditionally within 4.5 hours for many patients. New evidence and selected scenarios extend, modify approaches under specialist care. www.stroke.org. New England Journal of Medicine. Mechanical thrombectomy for large vessel occlusion. Best within approximately 6 hours, but in carefully selected patients may be offered up to 16 to 24 hours based on imaging and clinical criteria. www.stroke.org. Hemorrhagic stroke, intensive BP management, neurosurgical, neuroradiologic interventions as indicated. Supportive care includes airway, oxygen management, glucose control, fever control, and prevention of complications. 5. Secondary prevention and long-term management. Blood pressure control, priority. www.heart.org. Statin therapy for atherosclerotic disease. Anticoagulation for AF, after evaluating bleeding risk. AHA journals. Lifestyle interventions. Smoking cessation, healthy diet, exercise, weight control. Consider carotid interventions for significant symptomatic carotid stenosis. 7. Practical tips for caregivers and families. Learn be fast, monitor BP regularly, ensure medication adherence. CDC. Home safety. Grab bars, remove trip hazards, good lighting. Nutritional and swallowing management. Consult speech therapist if dysphagia. Support mental health. Watch for depression and refer to specialist when needed. Control blood pressure and detect atrial fibrillation. Dua hal ini menyelamatkan banyak nyawa. www.heart.org. +1. Cepat bertindak pada tanda stroke. Be fast, equals peluang pemulihan lebih baik. CDC. Rehabilitasi terstruktur and multidisiplin meningkatkan hasil jangka panjang. Cochrane. Thank you for watching this video all the way through. We hope the information shared was helpful for you and your loved ones in their golden years. If you found this video useful, please don't forget to like, share, and subscribe to our channel so you won't miss out on future health education content. We're committed to bringing you more inspiring content to support healthy and meaningful aging. See you in the next video. Stay healthy and warm wishes to you and your family.